I don't know.
Okay, I mean, you don't need to get there any specific time.
I don't know.
Welcome. I'm Sarah Hood, the Director of the Rutherford County Health Department. And as Director, I'm in charge of the management of the services that we deliver here at the department, such as immunizations, family planning, prenatal services, nutrition, WIC, and the many services that affect the citizens of Rutherford County. I'm also responsible for the budget where we hire the people, provide all the services and the needs of the department. One of the big things that we're involved in right now is the Smyrna Clinic. We're hoping to get a clinic built there that will service the northern end of the county.
Welcome to the Rutherford County Health Department. This is the old building. It's now used for administrative offices as well as an environment. It was built back in the 1930s. If you're around to the new building that faces Burton Street, you'll follow me, please. Sign in area, full name, birth date, and what kind of an appointment they have. Okay.
1620, that'll bring it up.
Clerk initials it, that they have the patient. They're going to look.
Are you single, Ken? Where did you finish in school? Tabby Fraser? No, you're not going in. Tabby Fraser? Tabby Fraser? Right here, she's going in. And what are you here for today? Wig. Wig. What time is your appointment today? There's just you. You don't have any children, do you? Tammy, you have one. You have three appointments? How old is the baby? Do you have Medicaid? How old is the baby? What's your big one for? Oh. I think mine is for. What's the appointment for? What's her name? Huh? Okay, what's your life? First name. Is your address still C6500? There you go. Sounds like everybody is. What's your apartment? Do you have a telephone? There you go. Okay, let me get their record number.
I'll give you.
My name is Mary Ann Smith. I'm the office supervisor here. And I have a great crew to work with. There are 10 clerical people think we make a great team to try to support all the people here in the health department and do all the paperwork and everything that needs to be done to keep it running. My job duties more or less consist of seeing that everything does go on like it's supposed to. Paying the bills, a little bookkeeping, just generally helping out with the clinic and supporting everybody.
I attend all records, which include death, birth, legitimation, monthly report, and just various other duties. I also do leave and attendance, I do typing for the health department, and fill in just whenever I'm needed.
Tell who you are and what
My name is Shirley Gates, and I'm Assistant WIC Clerk. Hi, Donna. How are you? Oh, she's down right there by those exits. Are you going to breastfeed, Donna? I'm going to try. I'm going to try to. Okay. Well, and your baby's due the last of this month. 26th of November. I believe, since you're not sure whether you're going to breastfeed or not, I won't give you an appointment. I'll just let you call back after the baby's born. And because you're getting vouchers through January anyway, that'll give you plenty of time to see if you can breastfeed. And at that time, you can make an appointment for the baby. Even if you're breastfeeding, you can still get supplement formula for the baby. I need you to sign this log right here, Donna, 5EX. There we go. There's your envelope. Just call us for an appointment after the baby's born.
She's our nursing supervisor. She's the lady that makes the schedules out for the nurses and tries to keep the clinic running as free and easy as possible.
Wait a minute, start over.
Very busy clinic today. As you can see, all of our doctors and nurses are really in a lot of conferences here concerning our patients, services that we can provide. In this area, the heights and the weights are taken. Finger pricks for hematocrit are done.
Stand up. Raise your finger. Okay, step up.
And as these are done, they are recorded in the patient's chart. All of these measures are very necessary.
And this concerns not only you, but your entire family, your grandparents, your mother and daddy, brothers and sisters, people that are close to you. Do you know if anybody in your family has ever died from or has now high blood pressure?
My mother does. My grandmother does.
What about a stroke? Has anybody ever died from a stroke?
Not that I know of.
How about diabetes?
My grandmother has diabetes.
Has anybody ever had cancer? No. Are there any inherited things in your family that go from generation to generation?
Palsy.
Parkinson's disease? What about you yourself? Have you ever been treated for any kidney problems?
Yeah, I've had kidney stones.
This is a very important part of the interview because this information is used for the nurses and the doctors in all the services that they provide for the health department. This is known as the patient history. It's usually taken by the nurse. This is provided by the health department. There are 2 nutritionists at the Rutherford County Health Department. The aim of this service is to provide nutritional information and WIC services for the clients that are income eligible and nutritionally eligible. This is one of the WIC nutritionists, Rita Fleming.
Hi, my name is Rita Fleming. I'm WIC nutritionist for Rutherford County. The WIC program is a program for women, ethnic children. There has to be a certified reason to be certified to the program, either medical or nutritional. And that's what my job is with those that need to see if he still qualifies to be on the program. I'm going to call the participant now. Brian Baskin. Have a seat. How you doing? Brian is 18 months old now. Has he had any problems, any health problems?
Not since he last.
Okay. How's his appetite now?
Very good.
Is he off the bottle?
Yes.
Now, I'm looking at his growth chart here. His weight or height was fine, right below the 50th percentile. And his height for age was good. And weight for age was good this time. Also, his iron count was real good. Is he taking vitamins?
No.
Let's see how well he's been eating then. Did you tell me what he had for breakfast yesterday morning? What about for lunch?
Yes.
Now, these big cups right up here, could you tell me approximately how much you had?
About 2 cups.
About 2 cups, you like spaghetti.
He likes anything.
Okay, is this with meat sauce?
And we are going to find out just exactly what the dental office does. I understand.
Go on in and do a little cleaning. Let's put this on. How's school going? That's good. Lean forward for me. Now what we're going to do today is cleaning, Elvis. This is pretty strong. Get it all up? Okay. And that'll get you clean for another year or so.
My name is Karen Hamilton, and I work with the Department of Health and Environment in the
Division of Children's Special Services, and I'm a social worker and care coordinator for the program. My specific duties entail coordinating medical services for children that are between the ages of birth and 21 years of age.
I'm Bob Moore. I'm a public health representative for the health department here. I represent the state of Tennessee in this area for the STD program, for the AIDS program, for the immunization program, and the tuberculosis program. I'm usually in this county several days a week. I work in Wilson County once or twice a week also.
I'm Sue. I'm the secretary for groundwater protection environmentalist and food and general environmentalist. In groundwater, we have 4 environmentalists who are in charge of the different areas of the county. They issue septic tank permits. And in food in general, we have 2 environmentalists with a supervisor. These environmentalists inspect restaurants, daycares, and some general sanitation complaints.
We conducted business on a day-to-day basis, and we hope you will enjoy our more lighthearted look at the way we look at ourselves. We'll make sure all the garbage areas are tight, lids on, plugs in the dumpster so there's no leaking. Got a plug missing on one. All clear? Inspector? Receptacle? You have your sanitizer in which here.
No, we're back here. No, we're back here. We'll take the dishes from here.
Are you just rinsing these here?
No, we'll take them in there and then we'll take them back here for all rinse. That's back here. Yes,
What
back
do you
there.
what do you use to sanitize? Chlorine?
Clorox, that's what they call it.
Clorox.
Back here.
We'll just walk on back here while we're doing that. Which compartment are you sanitizing in?
Right here. Right, the final rinse.
Chlorine solution. And it's about 50 parts per million, which is excellent. That's good.
We've been putting it in like now.
Okay, do you have the test kit to check it with? Okay, good.
I have them all.
Thank you. Yes, ma'am.
You said that was fine, so you please let me know what it is.
Probably want to replace the can opener blades. When you get little niches in them, it's time to get them replaced. Go in the cooler now.
That's the freezer.
Freezer. We're looking to make sure everything is up off the floor. Go in the cooler now. Some additional things going on here. Folks at Riverdale High School are recycling these cans back to a local person here in the county. Pays them a little bit for each can, so we recycle a little here.
Oh, that's nice. Recycling helps.
Looking for nothing but food here. This area has to be all food, no medications, no toxic materials that we're looking for. Everything properly labeled. Looks good. Got the top labeled on here is the salt and what it is. Sound condition on the cans is what we're looking for. Make sure that there's no dents, problems that would cause spoilage. Excellent job with the trap down here. Proper way to do eradication. We try to check the dry storage goods that come in. Even though they do proper eradication here, a lot of times in your dry products you'll get little critters inside. Need a little sweetener in here. Nothing major.